The Importance of Immunizations by Raven Willis. Vaccines can save your life and the lives of others. Protect yourself and protect others by getting vaccinated. Like seatbelts and car seats, vaccines can be lifesavers. In fact, the Centers for Disease Control and Prevention have said immunization is the most important public health act in the history after drinking safe water. For children, vaccines are critical to building their immune system. Each year, children continue to die from preventable diseases. Today, I would like to get into more details and cover 3 areas of vaccines. 1. How vaccines work. 2. History of immunization and producing benefits. And 3. The importance and need for immunizations. To get things started off, you should know how vaccines work. And how does a vaccine work, you ask? Well, let's find out. Vaccines work by stimulating our immune system to produce antibodies without actually infecting us with the disease. They trigger the immune system to produce its own antibodies as though the body has been infected with a disease. This is called active immunity. Although there are 2 types of immunity, active and passive. To brush up a little bit more, the first one I will talk about is active immunity. Active immunity is long-lasting and sometimes lifelong. As stated earlier, it results when exposure to a disease organism triggers the immune system to produce antibodies to that disease. Exposure to the disease organism can occur through infection with the actual disease, resulting in natural immunity or introduction of a killed or weakened from the disease organism through vaccination. Either way, an immune system comes into contact with the disease in the future. Their immune system will recognize it and immediately produce the antibodies needed to fight it. The second immunity is passive immunity, and unlike active immunity, it lasts only for a few weeks or months. Passive immunity is provided when a person is given antibodies to a disease rather than producing them through his or her own immune system. A newborn baby, for example, acquires passive immunity from its mother through the placenta. A person can also get passive immunity through antibody-containing blood products such as immune globulin, which may be given when immediate protection from a specific disease is needed. This is the major advantage to passive immunity. Protection is immediate, whereas active immunity takes time to develop. After finding out how a vaccine works, let's talk about the history of immunization. For more than 2 centuries, human beings have benefited from vaccines. Before the modern era of childhood immunizations, parents would have been surprised at the thought that future generations would be able to protect their children from many of the most serious childhood infectious diseases. Today, most children in the United States lead much healthier lives, and parents live with much less anxiety and worry over infections during childhood. Vaccines played a critical role in reducing childhood mortality, with an estimated 7.5 million lives saved over the last 10 years. Vaccines are safe and they work. In fact, serious side effects are more common than those from other types of medications such as antibiotics and fever reducers and pain relievers. Vaccines have reduced the number of infections from vaccine-preventable diseases by more than 90%. In 48 states and the District of Columbia, parents can request religious exemptions from vaccines, and 20 states allow philosophical exemptions, according to the National Conference of State Legislators. 2 states, Mississippi and West Virginia, limit vaccine exemptions to children who can't be vaccinated for medical reasons, such as having compromised immune systems. Everyone else needs to have their vaccinations or they cannot attend school. It has seemed that all the talk about vaccines has drowned out the benefits. But when you look at how far we have come at beating infectious diseases, vaccines are truly amazing. The shaming and the anger and the "you're dumb" kind of stuff that people are doing isn't working. I think it is making people dig in more, and it seems to me what has to happen is a different type of dialogue. That is a little bit more empathetic and more listening and more saying, I understand how you feel, and that is scary. Changing the way we talk about the issue, whether online or in real life, injecting more understanding into the discussion could also help persuade those against vaccinations. Furthermore, understanding why immunizations are important is a must. In public health, we talk a lot about how public health is often invisible. You don't think about what it does until you see an outbreak of a disease. I think it's those breakthrough disease outbreaks like we have seen recently that bring parents back to realizing 1 in 1,000 kids with measles could die, and several get measles and pneumonia, so they realize just how deadly and how serious it can be. Vaccinations protect others you care about, including family members, friends, and grandparents. When you vaccinate, you don't only protect your child, but you protect the individuals around you. If children aren't vaccinated, they can spread diseases to other children who are too young to be vaccinated, or to people with weakened immune systems, such as a transplant recipient and people who are battling with cancer. This could result in long-term complications and even death for those vulnerable people. The need for vaccination doesn't stop at childhood. Getting immunized is a lifelong and protecting job. We all have a public health commitment to our communities to protect each other and each other's children and families by vaccinating our own family members. To conclude this speech, I just want to say, vaccines are lifesavers. They prevent deaths estimated at 3 million children a year worldwide. Because we have vaccines, we don't see those deaths and illnesses today, much like our parents or grandparents witnessed in their day. It is important to keep vaccinating for everyone's sake. Stay smart, stay healthy, and stay vaccinated.